I came to Dr. Evans to start on Suboxone. I first was on a bunch of medication for a back injury I had about 5 years ago, and they put me on all kinds of pain medication, and I became addicted. I tried stopping cold turkey. I got really sick. I was sick for a couple of months, withdrawing. I was on antidepressants because of all the pain medications, because of the levels, and my serotonin levels were off because of that.
Patients that have addictions to narcotics and street drugs are now felt to suffer from a disease process in the brain that makes them very susceptible to craving for these substances. If they try to go off these substances by themselves, they often go through narcotic withdrawal, a very unpleasant array of symptoms that nobody really likes to go through. Fortunately, there is a drug available now that can help a person get off the addiction to these drugs without going through narcotic withdrawal. Counseling is a very important part of this therapy, in addition to the medication that's used to reduce craving. It can help maintain sobriety and long-term success with the medication.
All of our patients tell us that Suboxone treatments help them live a normal life. It frees them of their addiction without providing any risk that they will become addicted to another drug.
I take 3 8-milligram strips a day. It makes me feel normal. I don't have any cravings. I don't want to use drugs. I don't feel tired. If it makes me feel completely normal like I did before.
We counsel our patients that there are no quick fixes for an addiction like this, but through a Suboxone treatment, the good news is that the treatment will offer almost immediate relief, and it will allow them to live a normal life while undergoing treatment at Buena Vista.
I explain all treatment options to the patient. If they choose to be on Suboxone, then we maintain them on the medication as long as they feel they need it. At the appropriate time, we can discuss weaning off the drug if they're otherwise ready to do so.
Suboxone works because it takes up the receptors in the brain where addictive drugs like oxycodone and heroin connect to the brain. And Suboxone isn't addictive or intoxicating. It reaches its maximum active strength in the body quickly, and then the patient can continue to function with just a mild feeling of well-being. This gives them a better chance of recovery.
Ever since I got on the Suboxone program, I'm back doing everything regularly. My mind is right. I feel good every day. I'm not irritable. I don't have mood swings. I feel like I did before I ever started taking any kind of drugs or medication. I feel like a normal human being again.